Yeah.
Every time I get the flu shot, I get the flu. Therefore, I will not get the flu shot again. How many times have you heard this? Or maybe you've even said it yourself. Well, today I'm going to talk to you about the benefits of getting the flu shot. My name is Julie Pendleton, and this presentation is to give you a different outlook and change your perception and take a second glance at the pros of getting the influenza vaccine. Misconceptions about the flu vaccine effectiveness. Are there really benefits to getting the flu vaccine? While how well the flu vaccine works can vary, there are a lot of reasons to get the flu vaccine each year. Flu vaccinations can keep you from getting sick and getting the flu. Protecting yourself from flu also protects the people around you who are more vulnerable to serious illness. Flu vaccination can help protect people who are greater at risk of getting ill from the flu, like older adults, people with chronic health conditions, and young children, especially infants younger than 6 months old who are too young to get vaccinated. Flu vaccination also may make your illness milder if you do get sick. Now that we have discussed a few misconceptions about the flu vaccine effectiveness, let's talk about the reduced risks of the vaccine. Flu vaccines can reduce the risk of more serious flu outcomes, like hospitalizations. A recent study showed that flu vaccine reduced children's risk of flu-related pediatric intensive care unit admissions by 74% during flu seasons from 2010 to 2012. One study showed that the flu vaccine was associated with a 71% reduction in flu-related hospitalizations among adults of all ages and a 77% reduction among adults 50 years of age and older during 2011 and 2012. Flu vaccination is an important preventative tool for people with chronic health conditions. Vaccination was associated with lower rates of some cardiac events among people with heart disease, especially those who had the cardiac event in the past year. Flu vaccinations also has been shown to be associated with reduced hospitalizations among people with diabetes and chronic lung disease. Vaccinations help protect women during pregnancy and their babies for up to 6 months after they are born. One study showed that giving the flu vaccine to a pregnant woman was 92% effective in preventing hospitalizations of infants for flu. Other studies have shown that vaccination can reduce the risk of flu-related hospitalizations in older adults. A study that looked at the flu vaccine effectiveness over the course of 3 flu seasons estimated that flu vaccine lowered the risk of hospitalizations by 61% in people 50 years of age and older. A flu vaccination does not guarantee protection against the flu. Some people who get vaccinated might still get sick. However, people who get a flu vaccine are less likely to get sick with flu than someone who does not get vaccinated. Now, I would like to discuss the different types of flu vaccine. There are several flu vaccine options for the 2015-2016 flu season. Traditional flu vaccines made to protect against 3 different flu viruses, called trivalent vaccines, are available. In addition, there's a flu vaccine made to protect against 4 different flu vaccines, called quadrivalent vaccine. These are also available. The trivalent vaccine, or the 3 strands, protects against the H1N1 and H3N2, and then the influenza B. The quadrivalent flu vaccine, or the one that has the 4 strains of the flu virus, protect against 2 influenza A viruses and 2 influenza B viruses. Then you also have the nasal spray. All nasal spray flu vaccines for the 2015-2016 season will provide protection against 4 flu viruses: an influenza A H1N1 and an influenza A H3N2 and the 2 influenza B viruses. The nasal spray is approved for use in people ages 2 to 49 years of age. Who should be vaccinated with the nasal spray flu vaccine? Children, or who should not? Children younger than 2, adults 50 years of age and older, people with a history of severe allergic reaction to any component of the vaccine. People who are allergic to eggs cannot have this vaccine. People with a weakened immune system cannot have the nasal vaccination. What are the main differences between a flu shot and the nasal spray? Both the flu shot and the nasal spray help protect you from influenza, but there are differences to consider before deciding between the two. Now I'm going to show you a chart that I made to compare the vaccine to the nasal spray. So the flu vaccine, of course, is administered through a needle. It contains the killed virus that you can pass the flu along to everyone else. It is approved for use of people 6 months of age and older and can be used in people at increased risk of flu-related complications, including pregnant women and those with chronic medical conditions. Now, the nasal spray is administered through your nose. You won't need to get an injection. It contains weakened live viruses that won't give you the flu, but they, in a rare case, can be transmitted to others. It is approved for non-pregnant healthy people ages 2 to 49, not given to those with chronic medical conditions or immune-suppressed individuals or children and adolescents receiving aspirin therapy. Then I have shown, this is the injectable flu vaccine, and then this is what the nasal vaccine looks like. And then you just insert it into the nose, and they have to kind of tilt their head back and then kind of like breathe in to get it up in there, and it will run back into their throat, and some people do claim that it burns a little bit. Can the vaccine give me the flu? No. The flu vaccine cannot give you the flu, but you might develop flu-like symptoms despite getting a flu shot for a variety of reasons, including a reaction to the vaccine. Some people experience muscle aches and fever for a day or two after receiving a flu shot. This may be a side effect of your body's protection of protective antibodies. The nasal vaccine can cause runny nose, headache, and even a sore throat. The 2-week window. It takes about 2 weeks for the flu shot to take full effect. If you are exposed to the influenza virus shortly or during that time period, you might catch the flu. Mismatched flu viruses. In some years, the influenza virus used for the vaccine does not match the viruses circulating during the flu season. If this occurs, your flu shot will be less effective, but may still offer some protection. Other illnesses, many other diseases, such as the common cold, also produce flu-like symptoms, so you may think that you have the flu when actually you do not. What kind of protection does the flu vaccine offer? How well the flu vaccine works can vary. As I mentioned earlier in my presentation, according to the CDC, in the past flu seasons, when the match between flu vaccine and circulating strains of the flu virus is close, a flu shot is 71% effective in reducing flu-related hospitalizations among adults of all ages and 77% effective among adults age 50 and older. The flu shot may reduce the child's risk by 74%. Can I lower my risk of flu without getting a flu shot? With or without a flu shot, you can take steps to help protect yourself from the flu and other viruses. Good hygiene remains your primary defense against contagious illnesses. Wash your hands often and thoroughly with soap and water. Use an alcohol-based sanitizer on your hands if soap and water are not available. Avoid touching your eyes, nose, or mouth whenever possible. Avoid crowds when the flu is most prevalent in your area. Practice good health habits, get plenty of sleep, exercise regularly, drink plenty of fluids, eat a nutritious diet, and manage your stress. We all have the right to decide if we want to get vaccinated against influenza or not. However, please consider the benefits to protecting yourself and others.